Hello my people, welcome back to my channel. It's Dr. Sisi, and here on my channel we talk about health and wellness topics to help you stay informed and empowered. So if you are new here and you haven't hit that subscribe button, please subscribe to this channel because you are going to gain a lot of health tips from this channel. Okay, now let's be honest. I know we all poop. Yeah, we all poop. But do you know that your poop can tell you a lot about what is going on in your body? Yes, it can tell you a lot about your health. From the color to the smell to the shape, your stool can give you serious clues about what's going on with your liver, your immune system, or even your digestive system. Now, let's break it down. Why should you care about your poop? I'm not talking about your stool might actually sound awkward or even funny, but trust me, your stool is like a mirror into your gut health. Ignoring your stool problems can mean missing out on some signs of infection, liver problems, or even nutrient issues. Now, let's start with what is considered a normal stool. The color. For the color, it can be medium or dark brown. For the shape, it can be smooth or sausage shaped. For the consistency, it should not be too hard or not too soft. For frequency, once a day or even every other day is okay. Some people might actually have a bowel habit of twice in a day. That's okay. Now, effort is also part of the things considered to be normal. For the effort, it should be easy to pass your stool without straining. So if your stool matches all these that I have mentioned, congrats, your gut health might just be good. Now let's talk about your stool color. Yes, it matters. Let's talk about it. So if you notice your stool is kind of greenish, well, it might just be from the leafy green veggies you ate or food coloring, but it can also be from diarrhea passing too quickly. If you notice your stool is black, it could just mean that there might be bleeding in your upper digestive tract, or it could just be from iron supplements or certain medications. Yes, there are some medications or even iron supplements that can make your stool appear black. If you notice your stool is red or comes with blood, it may just indicate there is bleeding in your lower gut. So it could just be an hemorrhoid, or it could be something more serious like colon issues. So you might just need to get checked. You notice your stool is pale or clay colored, it could just signal a bile duct blockage, or probably there are some issues with your liver. So you might need to get checked. Notice your stool is yellow or greasy. Might just be a sign of malabsorption. That is, your body is not absorbing fat properly. It's common in conditions like celiac disease. Now, what about the shape and the texture? Well, let us just categorize this based on Bristol stool chart. Yes, there's a chart for stool. So let's just categorize this based on different types. Let's just simplify it into three main categories. So category 1, let's class it as type 1 and type 2. This is whereby the stool is hard. Probably the person is constipated. So the stool appears as small hard lumps. It will be dry and painful to pass. And what could actually be the reason why this is happening? It might be as a result of dehydration. Probably you're not taking enough fiber or even stress. What about the second category? We'll class this under type 3 and 4. This is the normal stool. And how is the shape and texture supposed to be? It will be sausage shaped, smooth, or with even small cracks. And it's usually easy to pass. Now, what about the third category? This is type 5 to 7. This is the loose stool. Probably the person has diarrhea. And this one is soft blobs to watery stool. And different causes might include infection, food intolerance, medications, or a condition we know as IBS, irritable bowel syndrome. Now, what about the smell? Well, let's be very honest. Poop smells. But if it's extremely foul smelling, oily, fishy, it may be a sign that there is trouble. So it could be a sign that probably there's an infection, there is malabsorption, or even parasites. Some poop-related symptoms are red flags. Please see a doctor if you notice blood in your stool. If you notice a black tar-like poop. If you notice sudden unexplained weight loss. If you notice persistent diarrhea or constipation. Or you notice diarrhea alternating with constipation, it might just be a red flag and you might just need to see a doctor. You notice when you try to stool, it comes with severe abdominal pain. Or you notice that your stool is usually greasy and floating most times, it might just be a red flag and you might just need to see a doctor. This could just be signs of liver diseases, ulcers, or even inflammatory bowel disease like Crohn's. Or it could even be a sign of colon cancer. So please, you notice any of these red flags, please try to see a doctor. Is there a way you can keep your gut and your poo healthy? Yes. To keep your digestion and poo in top shape, 1. Eat fiber-rich foods. You want to eat a lot of leafy greens, vegetables, whole grains, and even fruits. You also want to ensure to stay well hydrated. You want to drink at least 2 liters of water daily. You also want to avoid processed foods or junks. You also don't want to ignore the urge to poo. So you feel you need to poo, please visit the restroom. You also want to get enough sleep and manage your stress. So yes, your poo really just says a lot about your gut health. Don't ignore what your body is trying to tell you, even if it is coming from the toilet. If you learned something today, please don't forget to give this video a thumbs up. And also share this video to others who might find this video helpful. So thank you for joining me. Until next time, stay healthy, stay regular, stay updated, stay curious. It's Dr. Sisi. Bye.